Welcome to the series of talks on PCOS. We shall be discussing various aspects affecting a woman with PCOS. To begin with, let's discuss about losing weight with PCOS. Polycystic Ovarian Syndrome is a very common and a complex disease affecting 1 in every 5 women in their reproductive age in India. It involves multiple systems of the body like the nervous system, the digestive system, and has multiple causes and affects not just the reproductive function of a woman but also affects the functioning of various other body organs. PCOS has an impact over the mind and the quality of life of a woman as well. There is a disturbance in the hormones, in the essential hormones like insulin, which is involved in maintaining the metabolism, the way our body uses the energy, in hormones like androgens, which are essentially male hormones but are required in small quantities in women for maintaining the balance in the reproductive hormones. So the ovaries also might show with numerous small fluid-filled sacs called cysts, and hence the name Polycystic Ovarian Syndrome. Well, how do I know that I suffer with PCOS? What are its symptoms? To begin with, PCOS leads to irregular cycles. Sometimes they are heavy, there is heavy bleeding, sometimes it is scanty, sometimes you may miss your cycles for months together. PCOS also presents with acne, weight gain, hair fall, excess facial hair and male pattern of hair growth, changes in the voice. It may lead to hoarse voice in women. But these are commonly known symptoms. It might also present with other symptoms like erratic hunger patterns. Sometimes you feel very hungry, sometimes you don't feel hunger at all. Inability to digest certain foods, there could be certain allergies to certain kind of foods, sleep disturbances, skin darkening, constipation, there could be bloating, mood swings, depression and anxiety as well. So these are some of the symptoms of PCOS that are seen in women commonly these days. Now coming to the causes, what leads to PCOS? Now this is an area where a lot of research is still going on and a lot of advancements keep on taking place each day. So the understanding that we have now is that PCOS is a very complex disease, like I said, and here one thing leads to another with very less evidence of what is the starting point of the problem. Genetics, environment, lifestyle are all the causative factors of PCOS. But broadly, what causes PCOS is, first thing, it could be genetic. That is, it might run in your family. You might have the seed that has the potential to cause this problem and develop into this condition later in the life, or a trigger might lead to its manifestation as well. It is also a major lifestyle disorder these days, and hence an unhealthy lifestyle can lead to PCOS. Unhealthy lifestyle as in a faulty diet. We have quick access to easy food these days. Our lifestyle is such that there is very less or minimal activity, and there is a faulty exercise pattern and inadequate and disturbed sleep. So all these lifestyle related causes also lead to PCOS. Women with PCOS have chronic inflammation, a pathology where there is generalized inflammation, swelling to the organs in the body, to the tissues in the body, and it leads to an altered immune system that again leads to damage to various organs and tissues and disturbance in the hormones. There is an imbalance in hormones like insulin, androgens, and the female hormones like estrogen. Stress plays a major role in causing PCOS. Stress of any kind, physical, mental and emotional. It affects the nervous system, it affects the gut, it affects the adrenal glands, and it leads to release of excess stress hormones, which worsens the situation even further, causing hormonal imbalance. Another cause that can worsen PCOS is dietary deficiencies. Deficiencies in minerals and vitamins that are essential in producing good hormones. So why is it important to address these issues? If PCOS is left untreated or it is neglected, It can cause multiple health issues in the long run like diabetes, obesity, infertility, liver diseases, metabolic syndrome which comprises of abnormal cholesterol, high blood pressure, high blood sugar, heart related problems. PCOS also increases the risk of cancer, and it can affect the quality of life of not just the woman but also the family. So it's very important to attend to this issue, and popping hormonal pills for getting the cycles or controlling the blood sugar levels or taking pills to induce ovulation or even a surgery to pop the cysts isn't a solution. Rather, these are all quick fixes to achieve a short-term goal like for conception or to get your cycles, and these are never treatments per se. PCOS requires a holistic and an all-round approach and a treatment, and hence the role of Ayurveda and yoga is very important. So, weight gain is the most burning issue with PCOS. There are a lot of women, a lot of patients who've come to me and said that they've gained so much weight in the past couple of months or couple of years, and whatever they do, it does not result into weight loss. And whatever diet they follow, whatever exercise, how much ever exercise they do, it does not result into weight loss. So now let's first understand why is it so difficult to lose weight with the presence of PCOS. So disturbance in hormones like insulin, androgens, estrogen in turn leads to food cravings, erratic hunger patterns, and disturbance in the way our body responds to the urge of hunger. There is excess fat deposition, especially in the central part of the body, around the abdomen, the buttocks, the thighs. The metabolism slows down. There is increased fatigue and tiredness, and making it even more difficult to lose weight. This excess insulin promotes fat storage and increase in the bad cholesterol as well. Ayurveda looks at the root cause, which is the disturbance in the Agni or the innate metabolic fire which is required for multiple processes in the body. So when this fire is dampened or disturbed, there is improper formation and functioning of the dhatus, which are the tissues and organs of the body. And due to various reasons like faulty lifestyle, genetics, incomplete knowledge and awareness about the situation, and incorrect methods of exercising and following a diet makes it even more difficult to lose weight. How to deal with it the right way? To lose the excess fat at the same time maintain the healthy weight of the body, three things have to be looked into. First is food, sleep, and a disciplined lifestyle. So let's talk about food. The mantra for health is eat only when you're hungry. Take this, it is a mantra for good health and good hormones. We keep stuffing our body with food even when we are not hungry, even when the previous meal isn't digested. Keep your body light. Eat a little less than what you're used to eating, and give some space for the stomach to churn and digest the food. Fasting once in a while is very good. It by itself is a medicine and cures most of the problems. Eat mindfully. This way you know how much food your body actually requires and you don't tend to overeat. Again, overeating is the root cause of difficulty in losing weight. Include a variety in your meals. These days, following a certain diet, a certain fad diets, we end up eating only one variety of food. This itself is detrimental to health. So eat at least 6 to 7 varieties of vegetables and fruits in a week. Include all the 6 tastes in your diet that Ayurveda talks about. Give up fad diets, intermittent fasting, going on raw food, keto diet. All these fad diets put your body in a state of emergency, and once you come out of this diet, it takes a very long time for your body to heal from the effects of these diet itself, leaving aside the main problem. Eat freshly cooked and warm food as opposed to frozen and processed food. The more the food is processed, the more difficult it gets for digestion. Ayurveda has certain guidelines for eating. Eat according to your desha, according to your kala, vaya, prakriti. Include good fats like ghee, coconut oil, nuts in your diet. Remember, good fats produce good hormones. Eat an amla every day. Amla is an excellent anti-inflammatory and an immunity booster and a hormone balancer. Take care of your gut. Remember, your hormonal health depends on your gut health. Start your day with something that is calming, soothing, and appetizing, as opposed to something that is a stimulant like drinking tea or coffee on empty stomach. Coming to the second factor, sleep. Sound sleep of 7 to 8 hours is an absolute must. Sleep repairs the inflammation and maintains the hormonal balance. These days we tend to sleep at 12 am, 1 am. At midnight we should be fast asleep because that's the time when the brain secretes these essential hormones. Your hormonal balance is very crucial, and female hormones are very sensitive to lack of sleep, disturbed sleep, or stress of any kind, be it physical, mental, or emotional. Avoid sleeping in the day. A quick nap in a reclined position of 15 minutes is good, but a good night's sleep is very essential for maintaining hormonal balance. Talking about the third factor, a disciplined lifestyle. And the most important aspect in this is exercise. Always choose consistency over intensity. Exercise should be more as a mode of life rather than a way to lose weight. Choose moderate intensity exercise over high intensity exercise, especially for women. And yoga is the best form of exercise as well as a best way to balance hormones, the nervous system, and to stimulate the muscles and internal organs to function well. Have a moderation in activity and rest. It is good to be active throughout the day to get a good night's rest. Sedentary lifestyle is the biggest killer. Avoid sitting for long hours. Keep your body moving. Walk as much as you can. Coming to the most important aspect when it comes to dealing with PCOS. Stress is the major cause of PCOS and it can worsen the condition as well. So meditation and pranayama is an important way to deal with PCOS. Meditation not just reduces stress, but it also calms the nervous system, it also balances the hormones, and it is an excellent way to give rest to your body and your mind as well. Breath is again a very important source of energy and a very potent way to let the toxins out of the body. In fact, after exercising, a good 20 minutes of pranayama and meditation can help you reap the benefits of this exercise. So for more personalized treatment, diet and exercise charts that are required to deal with PCOS, do have a consultation with our Shri Shri Tattva doctors. The link for consultation and appointments is linked below. So like I said, this is a series on PCOS, and in the coming episodes we will be talking about various other aspects like how to deal with PCOS and stress, and how stress affects PCOS and what to do about it. We'll be talking about skin and hair care with PCOS. So if you have any questions or queries, do drop it in the comment section below and stay tuned.